Hi, I'm Dr. Kaustubh Mahajan, Neurologist attached to Holy Family Hospital and Raheja Hospital. I'm going to talk about migraine. We all have some idea about what is migraine. Migraine, the word has been literally derived from the Greek word hemikranios, which means half head pain. Migraine can be a very disabling condition. It is usually most commonly presented as headaches, which is one-sided, but headache can be just the tip of the iceberg. There can be giddiness, there can be fear, there can be visual symptoms, there can be swallowing problems at times, and there can be one-sided weakness also. What is important is to understand what you are suffering from and get the treatment as soon as possible. Migraine is a condition which usually affects the younger generation. Unfortunately, because the younger generation are affected, and it is one of the most disabling conditions which can happen to a younger person. It is, in fact, because of the days which are left and they don't go to work because of migraine and headaches, the loss to financially which happens to the society is in billions. So it's not just an headache. Sometimes it can be so severe that patients can think of committing suicide as well. So identifying it is very important. There are certain do's and don'ts about migraine. You have to identify the triggers. A patient with migraine should have a diary and see whether what exactly is triggering or provoking an attack. He should mention them in his diary, his or her diary, and try to avoid them. That's the best possible thing which one can do to prevent future attacks. The usual triggers are lack of sleep, empty stomach, physical and mental stress, then certain food items like caffeine, beverages like aerated drinks, cheese. So all these things you have to identify. Some patients have very specific food triggers, like even eating tomatoes or eating fermented objects like idlis can trigger an attack. So you have to identify them and avoid them as much as possible. There are certain things which patient with migraine has to do so that he comes off the medicines earlier. Certain lifestyle modifications. The lifestyle modifications include that he should have a proper sleep, which includes at least 6 to 7 hours of a night sleep. Oversleeping can also cause migraine headaches. That should be also kept in mind. Second is he should not try to be empty stomach anytime. Fasting can trigger attacks. These patients themselves know, and you should avoid them. Third thing is usually physical and mental stress can also, there is nothing we can do to prevent it. It is always going to happen. So then the role of medications come. You also have to exercise regularly. Aerobic exercises in the form of at least half an hour daily. Running, walking, swimming, jumping has to be done daily. The chemicals released by these exercises usually prevent future attacks and help you to get off the medicines as early as possible. So precautions which a patient with migraine patients with migraine or migraineurs have to keep in mind is avoid your triggers. One main thing, for that you identify them properly. Second is take your medicines as prescribed by your doctor regularly. Usually you may feel better, but take it according to the course with which it has been prescribed. And daily exercise, which is very important.